Did you know that text neck is not only associated with neck pain, headaches, pain and tingling in your fingers, early arthritis, and degenerative disc disease? It's also associated with conditions like heart disease, GI disorder, temporomandibular joint dysfunction, breathing compromise, and even depression. I'm Dr. Megan Von Holtz, and I want to go over with you today, one, what is text neck, and then two, some of the reasons that we really should be looking at this because it's turning into a global problem. First thing, what is text neck? The easiest way to think about it is it's a syndrome that comes when we spend too much time in this forward flex posture using our mobile devices. If I show you here what a normal neck curve looks like, this patient is actually a 40-year-old patient with a beautiful neck curve. And we can see that each bone and disc in that curve shape like that helps to hold up the 10 to 12 pound head that we have. The other thing, there's this little half circle here. If I draw straight down from there, that's like the center of gravity of the head. So as she has it right here, all that weight is going right over all the strong muscles and bones in her neck. So that's the ideal posture. The problem with text neck comes in the position that we have our neck in. Like if we look at this one, just 15 degrees of flexion in the neck is enough to make that 10 or 12 pound head actually feel like a 27 pound head. If I think about even just a simple gallon of water, like I can hold this in close all day long, not a big deal. But if you made me hold it out here, even after a few minutes, I'm going to have trouble holding that up. It weighs exactly the same here and here, but the perceived weight is actually a lot more the further away from my body I get. So if we look back at these, that little bit of flexion increases the weight too. And if we look at the far end, 60 degrees may seem like a lot, but I've seen many people sitting there playing games with their head flexed forward 60 degrees. And that says it creates, instead of a 10-pound head, a 60-pound head. Now, half of you wouldn't pull a 50-pound bag of dog food off the grocery store shelf. Would you want that on the back of your neck? That is, in effect, what you're doing when you hold your head like this when you're using your cell phone. The other thing that isn't talked about a lot is the breathing compromise that's created. So there's actually published research that says you can get up to a 30% decrease in lung volume with your head being forward like that. Think about that. Like, we need oxygen for everything. To think, to digest, to fight infection. I mean, talk about brain fog. If you're having trouble thinking, maybe that's part of the problem. If these health things are not making you think twice about how you're holding your phone, maybe something cosmetic will. I have a lot of patients who talk to me about this hump that they're growing on the back of their neck. It's not that you're growing a hump on the back of your neck. If we look at the picture here, you can see when the spine's in its normal alignment, we really don't see much of a bulge there. But in this one, it really makes that upper back very prominent, and that's why it looks like a hump is growing from your upper back. Those muscles are giving it all they got to hold your head back, and actually looks like it forms a bump. So it's kind of depressing thinking of all this. The good news is knowing is half the battle. If you know that this is possible, then when you're using your phone or when your children are using their game consoles, really talk to them about holding their posture up or holding the device up. Or if there's no way to hold that device up, at least tilt your eyes down, not your neck down, and that can make a big difference. Here in the office, we use a patented weighting system called Pedimon that actually makes a big difference as well. But again, knowing is half the battle. If you can think of those things throughout the day, day after day, year after year, that could make a huge difference in your life. I'm Dr. Megan Von Holtz. Have a great day.